Hi, Support Fibro friends. It's Melissa from the Support Fibromyalgia Network. Welcome to this presentation from the Impact Fund grant and Support Fibro on the Road. Although we are staying put in home, so this is virtual from home as we do this presentation. The big point of this video for you today is to ask that question: how do you access food? And one thing too that came up with food access, which was water, clean water. So this is presenting to you this big question for those of you living with fibromyalgia and overlapping autoimmune conditions. How are you accessing food? Please share with us in the comments, send us messages. If you've figured out how to maneuver this system best and you'd like to share your story publicly with other people because it'll inspire other people and educate other people living with fibromyalgia, we would love to do that. We can do a video interview with you. We can do a blog interview with you. There's so many ways to share and this information, and we need to get everyone equal access to food and clean water across the board in the United States. So anyone living with fibromyalgia, we want to hear from you and to connect food and the quality of life with you. We want to make sure as an organization that no one is left behind. And I think unfortunately a lot of assumptions get made when it comes to quality of life. The CDC has admitted that people living with fibromyalgia have a lower quality of life, but now we're going to dig into those details and be able to submit this information to our government websites, to our representatives, to really show them the quality of life of people living with fibromyalgia. And we need as many people to help us in this journey, to fill out the surveys, to give us a response. So please share this video with other people in the community who are living with fibromyalgia and tag your friends. If you know someone who's really struggling to get these resources, please tag them because we are connecting the dots. We really believe and we take action when we say this, that no one is left behind in this fight. And that's what we're pursuing, and we're taking action as we move forward with what we need to do for the fibromyalgia community. So a big thing here is food access, fibromyalgia overlapping conditions. So even if you are diagnosed with an autoimmune condition, if you have a diagnosis of fibromyalgia, this involves you as well within the grant system. So we're going to be collecting surveys. They're going to be anonymous. I think at most we just need your zip code so we can put it on a map and give this information and visualize the data. And we'll be showing you some map systems connection when it comes to analyzation and how we got started in this project in the first place. Because I think it's hard. I think, again, it's quality of life. Eat healthy. Like maybe that's an advice that someone's, you got to eat healthy to improve, but what are those barriers? What are those challenges coming up? And I think there's an assumption, maybe people assume certain things about people with fibromyalgia. So we're sorting through all that nonsense. No more assumptions made, getting real resources to people as they need it. Food choices and food health. Adequate food access helps us to enable food security, whereby a person's dietary needs and food preferences are met at levels needed to maintain a healthy and active life. Okay, this is important for all of us, right? Our health is important. We talk about it all the time. But if you have barriers to get food and water, how is that affecting your health? How is that affecting the quality of life? We need to dig in more into these resources. The definition of food security, according to the World Health Organization, when all people at all times have access to sufficient, safe, nutritious foods to maintain a healthy and active life. Taking a look at that, digging in. Here are some of the challenges that, and this is not an extensive list, we would love for you to add to this list and share your challenges when it comes to accessing food and water. Chronic illness symptoms, it was difficult before. Going to the grocery store, having enough energy to even walk, get to the grocery store, get out of bed. Is this the case for you? It's gotten extremely difficult with COVID, and I know I've talked about this in previous videos, standing in line, in the heat, in the rain. So are you experiencing those as new challenges, and it's even more difficult for you to access food right now? Travel time for shopping. Some of you are traveling distances of like 30 miles, over 30 minutes just to get to a grocery store. I know I've done a lot of research recently on Dollar General and the business plan for that and how they're expanding into different areas. especially rural parts of the community, and the food offerings that they have, which ties into availability of healthy foods. Are you able to access fresh fruits and vegetables? Do you understand how to maneuver these systems, the WIC program, any farmers markets in your area? What is really available to you? Are you struggling with that? We need to hear from you, and we want to get you the resources that you need. Food prices. How was food prices before? I have seen statistics recently on how much food has jumped in price. I think I saw that beef has jumped 20%. Eggs is about the same, and chicken is over 10%. So accessing those, it's become very expensive. So is that what's going on now with COVID? And this is an interesting dynamic because food accessibility has come up as an issue everywhere for everyone. And we're taking a particular look at those living with fibromyalgia and overlapping autoimmune conditions because it relates to having chronic illness in these communities, in food deserts, rural parts of the country. But I'm seeing it everywhere. Unemployment is extensive right now. And how do you get those resources that you need? And the topics have come up of like food banks, there's distribution centers where you see the long lines of cars of people and they're giving you food. Please, if anyone's out there, I know there may be a stigma around this, but unemployment has become so widespread. You need to get food. Please access these resources from the food banks, from nonprofit organizations that offer that. If you don't know how to find those resources, we're going to be offering a lot of that system. That's what we're doing right now, connecting the dots for this time, not just COVID time, but it's going to continue. And I've been happy to see updates from the government websites finally for health resources. They've kind of neglected certain websites that I was digging through with information. It was really outdated, but now they've started to update them. So I'm excited for all of us because those are important resources to be able to access. Transportation seems to be another challenge from people. If you don't have a car or you're sharing a vehicle with someone else, how are you getting your food and going to the grocery store? Public transportation, is that even available? And these are systems. Are you easily able to take a bus to get to the grocery store? Is there anything else available? We talk sometimes about the transportation systems like Uber and Lyft, but I know that they're not available in all parts of the country. And I witness that when I travel and we go to other places and it's not readily available. I always check to see, just out of curiosity, or even things like Instacart, which people are using readily now. It hadn't been so widespread. I noticed that I wasn't able to get some groceries delivered at points, and I'm always checking when I'm on the road. So we definitely want to hear from you when it comes to that. Food deserts, particularly looking at these food deserts. And I love what's happening now with more organizations coming in to help people access food. Let's continue it past COVID so we can continue to get you the resources you need. Food deserts, limited access to affordable and nutritious foods is kind of the definition of it. There was a survey done in 2010, 23.5 million people in the US live in a food desert. So do you know that you live in a food desert? Lack of suppliers of fresh food. I would love to hear how this has changed. Has it gotten better? Has it gotten way worse with the delivery systems? And is it taking much longer for you to get your food at the grocery stores? 20% of rural areas are food deserts. So this is an interesting overlap if you're living in a rural community. Rural communities, 15.5% of rural residents live in food insecure households. 5.8% of rural residents travel between 10 to 20 miles to the nearest supermarket. Is this something that you have to do on a regular basis? I know you may be stocking up more, but is this one of the challenges for you when it comes to accessing food? Lack of transportation infrastructure, again, public transportation, how readily available is that? Are there other systems involved with getting you food or taking you to get food? You're more than likely to have a chronic disease and disability living in rural communities. I was looking for more statistics. If anyone happens to know the deep down statistics, I kept digging, but all I would keep finding is similar paragraphs. So not really too detailed of information, but I would love to get at this even more because we're addressing this on a chronic illness space, and it is specific to fibromyalgia, but I think it's important to help government agencies know that we're out there, our voices matter, and we're struggling to get this because it can get overlooked. I know a lot of when it's chronic disease mentions heart disease, diabetes, and those things, which some of us may be managing as well, but I really want the extensive chronic illness to come together so that we can get these resources to people that need it. And then all the people around, if you're a community health worker, you understand what fibromyalgia is. And if you're interested in being a part of this, please definitely reach out. We need to connect with more community health workers if you are one or know one, nurse practitioners, doctors, because this is going to connect with Project Echo and tie it in, because we can hone in on certain areas, particularly if you're living and we have maybe a higher group of population, maybe there's one provider serving these areas, we're going to invite them into Project Echo for the medical education so that they can service the fibromyalgia community much better. Or if there's other healthcare workers in this area, let's get them educated to what fibromyalgia is and the quality of life and what resources are going to be needed so they're more well aware. And that way you don't have to over explain yourself constantly, and you might be frustrated in finding what those resources are. So one of the tools that we used in order to first put together this initial research, which piqued my curiosity, was the Food Access Research Atlas. So I'm going to try to do another share with you to show the map and what the tools we're going to use. And these maps are actually built by Esri. Support Fibro is a nonprofit partner of Esri. We're using the same software, and we deliberately did that because we know that we can submit our mapping systems to government agencies, and we can present this to our representatives, and we can use the data that's already aggregated in the government agencies to create an overlap of what we need to work, overlapping data systems. So that's why it's important that we use Esri, and I'll talk about it more in a more different separate mapping video. So I leave you with the big question. Please let us know, Support Fibro friends, how do you access food? How do you access food? Are you getting clean water? Do you have the water system set up? I mean, man, I was watching a documentary and I saw this place in West Virginia. They don't even have running water. So, and this become more widespread, and I need to connect with an organization that's addressing this, because it wasn't just on the reservations and things like that, but it's more widespread than we even know. And don't even get me started with some of the chemicals in our water, which is the different issue that we've never really addressed with our infrastructure. But it's important. I want to hear from you of what you're going through, because food and water connects with your health. And we know that health is important to all of us. So how do we move forward? How do we take down the barriers for you and be an organization that steps up? So we are working to improve quality of life for people living with fibromyalgia. We are taking action. So please definitely share with us your experience, post comments, send us messages, share with your friends, because we want to hear from everyone. We will have surveys coming up on quality of life. We're fine-tuning them. A lot of the government surveys on quality of life are pretty long, and we're trying to make sure that kind of applies more to people living with fibromyalgia. So we're taking some of that data. We'll probably have a short survey and a longer data, and we'll ask people for favors if you can fill out the longer surveys, and really help us, because it's important we do this legwork and get this information to our representatives, our government, other companies in the healthcare network, because we need to tell them, like, look, we need a resource in this location. So can you set something up? Is there a way to get more resources here so that people can better access it? You know, you can't be driving all across America right now. You can't be driving all across America pre-COVID to get the resources you need. So this is what we're fine-tuning details. And again, we say it all the time, no one is left behind. We are executing on that. We mean it. We're doing and moving forward for fibromyalgia. Thank you, everyone. So Support Fibro, supportfibro.org. We have some new updates coming. We're going to be putting out some videos. So happy to share that with you. Let me see if I can pull up the atlas for you for the Google Atlas, the Food Access. So it's Food Access Research Atlas. So I'm going to definitely post a link for that. And all you have to do is enter the map And then you have a map system here, and you can pull up different regions. You can pull up where you're at, so you can see what level of food access you're at with food deserts or rural parts of the country. I know they have a separate mapping system for rural communities, separate website when it comes to that. But it's, you know, US Department of Agriculture has put this together. So you can really click on it, use the legend, low income census tracts where a significant number or share of residents is more than 1 mile or 10 miles from the nearest supermarket. So we're going to use this information to layer our maps and implement where people living with fibromyalgia are. We would love to expand this one day and include just chronic illness across the board, or even chronic pain. So we would love to work with other organizations that are interested in doing this. We do use Esri. We are an Esri partner for their nonprofit, so we're excited to use their software and get this going. And you can see how nice it is to visualize the information. So not only will we be sharing stories through videos and blogs of experience, but we're going to visualize that data for people that are more analytical, who the bottom line is about profit or money and all this stuff, and speak their language and submit this to the government agencies, because that's the software tools that they use. So I appreciate you taking the time to join me today for this video. Thank you so much, Support Fibro Friends. Group hugs to all of you. If no one has told you today, you are worthy and you are not in this fight alone. I will talk to you soon. Thank you. Bye.